but I just want you to tell me a little bit about your endeavors, about yourself. Describe Spine Care Partners and what you're doing these days. You've mentioned that you're semi-retired, but you'll never really retire from all this stuff that you have going on. So, tell us a little bit about all this.
Yeah, I mean, it's a long journey getting here, Vinny. We all have our journeys, right? There's a beginning, there's an end. Right now, I'm right smack dab in the middle of that journey. So a lot of experiences coming up to this point. I did have a long time in private practice, face to face with patients, 37 years actually. But during that time, I had gone to law school. I'm a medical attorney. I've had integrated practice throughout my career. In my office, we've had PM&R, chiros, physiatry, which is PM&R, neurosurgery, massage therapist, physical therapist, so on and so forth. But this whole idea has led to a collaboration with several colleagues of mine. We started Spine Care Partners about 13 years ago. And what we do is we go to payers and we help payers lift to their provider networks. And there's tons of stories behind this, tons of data, tons of the why, but there's always that need to try to get these different providers of a different ilk, neurosurgery, PM&R, chiro. How do you get them to play nice in the sandbox? We're all speaking different languages. We all have different silos. We all have a different idea on what spine care should look like, but there's a method behind our madness, and that's pathway-based spine care. We've published on that. We Spine Care Partners. We do have this spine care pathway that we teach to different groups, and then these groups go out and disseminate this amongst themselves. They treat patients based on this best evidence pathway, and everybody's happy. So what you get is through a patient's journey and their episode of pain, they, depending on what they have and when they have it, and how they present, each clinician, regardless of the tool sets they have, they treat the patient according to best evidence. So that's what it's all about. And lo and behold, chiro becomes so darn important, as we all know, as that front end provider, because we take care of at least 85% of any type of spine problem that can come in your office. Society doesn't know that. Different stakeholders don't know that. We know that, but that's what we try to do with Spine Care Partners.
Excellent. Excellent. That's a great way to, advance the profession and really exponentially grow what it is chiros do by helping them be better chiros.